My name is Rob Douglas. I'm the founder, chairman, and CEO of BioConnect. And I actually believe today is our destiny that we would meet. I can honestly say to you 4 months ago, I would not have imagined that I would be here talking about something that BioConnect can do to help us all around COVID. But nonetheless, the world has changed. And I really do believe that this is our moment together to talk about things that we can do to help prevent the second wave or spread of COVID as employees are returning to the office. And can you think of one CEO of one company on the planet that has not thinking about and being ready to report back to their board of directors of what measures are they taking in order to provide the safe return of employees and ensure and minimize the risk of no further disruption of their business operations? So what is the enterprise response? So let's talk about what we as an enterprise, what we've been doing. Well, the first thing we've been doing is part of Welcome Back is we've been putting in place PPE. We've been putting plexiglass dividers up. We've probably been spacing out people in terms of the workspaces that people can operate in. We've seen lots of innovations occurring in this area. We've seen wellness surveys. We've seen software companies coming out with wellness surveys to do wellness checks of people. And at a society level, in the short term, we've gone through a major lockdown, unlike one we've ever experienced together. We've now we're very active with the use of masks and social distancing or physical distancing as common ways under which we would interact to control this. We've now see contract tracing applications coming into the market. We see antibodies, and in the long term, of course, what we're all seeking is a vaccine. Here's some areas what the enterprise still needs help with. Is how do we provide daily declaration of employees' health status into actionable methods that can either grant or deny building access to reduce in-office spread? How can we do that? And I'm using the difference between a survey and a declaration. A declaration is like an accountability. I'm accountable for what I say in this information about my health as I'm now wanting to get back into the office. I'm looking for door tracing. If we find a situation where somebody has tested positive and they've been coming to our facilities, how can I quickly see where has that person been over the past period of time so that I can be looking at other people inside the facility who may have been affected? I'm looking for stronger compliance solutions. And oh, by the way, as we all see, regulations are continuing to evolve, and we've got to be able to have compliance, but it's not static. It keeps changing. So how do I put something in place that can adjust to this continuous change? Is there a way that I could get an early warning, a daily early warning of any risks or workforce disruption because of COVID outbreaks that are affecting my employees, as a way maybe to affect and change the workload or work plans for the day, or looking for alternate resources to be able to come in if in fact I'm experiencing an outage, if you will, because of COVID infections. At the same time, if I'm asking employees to put in information about their health, how am I going to do that privately? Like, this is their personal private health information. Yes, sure, the organization wants to know it, but how do I make sure that it's guarded and protected for the employee? Similarly, if I'm sitting as the CEO of a company, as I'm the CEO of our company, is how do I contain the enterprise risk so that we don't face future disruptions, that we can sort of manage and navigate our business through this threat that is impacting our business. Oh, and by the way, if that's not enough, we got to do it all from home. How am I going to enroll people? How am I going to accept people into my buildings? How do I deliver new health and safety procedures? And I got to do it remote. I've got to be the one, maybe as the administrator doing it, but also all these people are going to come into my facilities. How do I connect them remotely into this healthcare system or this wellness system so that I can have higher levels of protection of employees? So I'd like to introduce you to BioConnect's Wellness Declaration Solution. So the basic idea, well, the user is still going to show up with a card. They're going to present their card on those card readers that you all have in your buildings. They're going to receive a push notification to their phone, but now it's actually a declaration survey where their health, they're answering questions of their health. Have you ever crossed a border before, and as part of crossing to a border, you're actually asked a bunch of questions like, do you have more than $10,000? Are you carrying any fruit and vegetables? You know, you're actually having to declare that you're in compliance in order to be authorized to go into another country. Well, think of that as the same idea of declaration of your health. So how is my health at this moment in time as I'm trying to enter into the facility? I'm now linking a declaration of health with the physical access, and if I succeed at answering the questions that I've not been in contact with anyone, and I do not have the symptoms, and I've not left the country, then I'm going to be approved, and those two things will allow me to gain access into the facility. The other thing that's neat about it is that our customers have also asked, can we do it from home? So do I have to wait for the employee to come to the office before they present their card? Or could I get them to do the wellness declaration at home in the morning and then come to the office and just present their card? And the answer is yes, you can. In fact, it's on a 24-hour basis. So each day, once we clock into the next day of 12:01, the employee, when they get up in the morning, if they get up at 6 in the morning and they have to be at work at 8:30, they could choose to just pop onto the survey. It takes you like 2 seconds, and you can authenticate your health as one step, and then your second step is your normal physical access card in order to get in. So what are the benefits of this? You can see, by the way, here's examples of the types of questions that would be asked, and I'll show you in more detail about this as well. Here's the neat part about it. The neat part is we've now connected your current status of wellness with whether I'm going to authorize you to get into the facility. Is that important? Well, we think it is. And we see other customers who are indicating that they see the value in that, which is if you're not well and you can't pass the threshold of wellness, then we really don't want to grant you access into the facility and run the risk of the spread of COVID inside of our facility. The second thing that's neat about it is it's touchless. So I'm in possession of the card, so I'm in control of the card. I'm in control of my mobile device, so I don't have to touch anything. When I get to the facility, I've got high security, I've got my health confirmation, and it's simple and it's touchless. The third area is that we provide is an alerting system and a compliance system. And the alerting is that if for some reason if I indicated on one of the questions that I currently have the symptoms and I'm going to be denied access, you can now through BioConnect, you can send that information into as an email to somebody to follow up on that particular individual, or to Slack as an example, and other communication platforms will be added, but those two are in there today, so that you can address it for the individual circumstance. You can then, of course, once we introduce in a moment, I'll talk about door tracing. If somebody's in the facility, we can also then trace back to see where have they operated inside of the facility to look for what we call door tracing of people who have been exposed to COVID. The other point I just mentioned at the bottom here is about compliance. So I think we all, as corporate citizens, we care about our employees. I think we all feel a sense of responsibility for the health and safety of our employees, for sure. And we've got a new one, which is COVID, which we've now got a health element inside of this. And so this particular application and service allows you to be able to provide compliance and also peace of mind within your own business that, okay, I've got good measures, I've got good controls around health. This is an example of the alerting that could happen. So an example could be this alert could go out through Slack or through email. It says, Jim White was denied access to the Toronto office front entrance. Jim has been in contact with 3 doors in the past 14 days. Based on Jim's recent contact points, 3 users have been identified as at risk. So this is really looking at where it is the risk exists inside of your facilities. So the other thing that's interesting too, is we've now released this solution, which is really just an additional capability to what we already have in market. I originally thought that what people are going to do is they're going to now deploy it across all of their door systems. And what we're finding is, yeah, sure, there are some people that are going to do that, but you don't have to. In fact, all you really need to do, what we've watched people do, is you just really want to hit your main entry points into your facility. So what's the main entry into your office building, or where are those? In this case, there's 2 entry points. So the amount of doors that you need to light up in order to connect wellness is actually fairly modest. So the user is presenting a card, and then they're receiving a push notification to their mobile device. And that push notification is now a wellness declaration, which is what you see here on the left. And that's really what we've built out into our capability, and have been able to do it so quickly because it's on top of our core platform. And secondly, or you could do it for wellness, you could also do face recognition. So if you wanted to add an additional layer of security of, I just really want to know that that really is the person, I could do that as well. And, or if I wasn't in the wellness use case, I could just have a push notification to come to my phone to say yes or no, like, Rob, is this really you? Yes, that's me. And so this is, again, providing higher security, but doing it in the context of wellness. The other comment I just draw attention to, which is also very important, we take data and personal information very, very seriously. So the whole architecture of this solution, which is really important also when it comes to capturing information about employees' health, is very important. So anything to do with the personally identifiable information of an employee remains on the device. The company does not get it. It will get encrypted information of zeros and ones, but it will not get the health information of a particular individual. And this happens to be the way the architecture is built, and it lends itself very well to this type of use case where I now need to do wellness checks or declarations every day, and how do I protect that information for the employee?